Today was a full-scale trauma drill, so we were pretending that a plane had crashed at LAX, not unlike what happened in San Francisco with the Asiana Airlines crash. Our emergency medicine center and our trauma center has to be ready to receive up to a couple hundred passengers. Remember, today's airplanes are quite large. The A380 has hundreds of people on it, and even a small airliner will have more than 50 or 60 people on it.
There was a very large expected disaster, so we took it all the way from the preparation where we get the initial call. We're anticipating up to 150 patients, and we did it as realistically as we possibly could. We had designated team leaders that weren't part of the clinical team actually providing care, because we still have to do that. So we had team leaders that then said, this is how many patients we can take immediate, this is how many we can take delayed, and then we started to assemble those teams in the back of the emergency department, trying to make it as realistic as possible.
Ice pack on that, clean that up.
We're a level 1 trauma center, so we're very used to receiving very sick patients with very little notice. We start triaging the patients out there, so we move teams of doctors and nurses outside of the normal environment. They start triaging the patients, treating the patients. The most critical patients get brought through into the main department for treatment.
Participating in exercises like this, functional exercises, full-scale exercises, where we actually get to pull out all of the equipment and supplies and have live volunteer victims that are moulaged with makeup and all of that, simulating injuries. It really allows our staff to be able to operate in a chaotic, stressful environment.
Yes, I am. I'm having a lot in there.
Okay, right here.
So with an unexpected disaster, the first component that makes things difficult is its very unexpected nature. So you have to be ready to deal with a swell in patients coming into the emergency department. In this case, we had to deal with our electronic patient tracking system going down and knowing how to utilize our paper-based system and then later integrate it back into our electronic system.
Some of the challenges today with the scenario that we have were that these are international patients that come in that don't speak English necessarily.
Okay, so dolor en su cabeza? Mucho en su garganta, ¿no?
We had people, simulated people from the FBI, from the FAA, and from police agencies, all trying to get information about these patients.
The biggest challenge is communication, and it's from the scene. We don't really know. Everybody's busy everywhere in a multi-casualty event like this, so the people at the scene are busy trying to take care of people that need them very quickly, and they can't take time out on the phone to tell us what's coming.
Am I late on? I can't sit.
And we were able to evaluate them and get people to the operating room that needed to go to the operating room, people to the ICU that needed to go there. And so far, we've been able to take care of everyone.
Sent 4 patients to the OR, correct? 4 patients to the operating room. We had 6 ICU patients, including one burn who's transferring to a burn center, and 2 pediatric ICU patients as well. All right, and a whole bunch of minors. So yep. we're doing.
Well, I think 2 things would surprise people. First of all, that we have the ability in a trauma system with trauma centers like UCLA to be able to take care of multi-casualty events. And I think the other thing that would surprise people is that not every city in the world has that capability, so we're lucky here.
And then we're going to pretend like this is the 9:30 update, so it's still 17 patients.
Okay.
I think my message to the public is that we at Ronald Reagan UCLA Medical Center drill frequently on events like this, and we are prepared to provide care should a disaster occur.